My views on the quality of access of healthcare in Antigua and Barbuda. A lot of us don't get the privilege to go overseas. We're not funded by the government. Something happened and the only thing we can rely on is our medical hospital, but sometimes cannot provide the essentials for us and we will have to go overseas. So I think we should do a little bit more and have that type of access for a low-income family as well as our high-income family. The part that I like the most in the DNA health policy is making mental health care more accessible to everyone. Especially in these times, these uncertain times through this pandemic, a lot of our young persons between the ages of 18 and 25 have difficulties coping with this type of situation. So we need to focus more on mental health.
As an Antiguan, I would like to say that the options of finding housing in Lani and Antigua is extremely hard, especially for youths who have not been prepared for this. I do not believe that the country's needs are being met when it comes to housing. I appreciate the DNA's policy when it comes to housing because they look out for the little guy. When it comes to the subsidized housing plan, it's an amazing plan going forward. I think it takes the worry out of youths in an issue where they have to think about the next 20 years of their life in building a family. It gives you the option to even rent to own. I love that policy. Renting to own gives us the option to go into rent, but knowing our money is going somewhere. I think that it'll be an amazing outcome to the country, to our youths and the next generations to come.
Good evening. Good evening, Antigua and Barbuda. Welcome. Welcome to the Democratic National Alliance National Consultation Series on COVID-19 and its impact on our society and our people. This is simply a platform to talk. We bring you, the experts, and you bring your thoughts, concerns, questions. Together, we conquer COVID-19. I am Malika Parker, the chairperson of the DNA and one of your moderators this evening. The session will be co-moderated by Ms. Chanel Imhoff, DNA's communications officer, and tonight she will be our social media navigational expert and guide. Tonight, Chanel will ensure that you, our listeners and viewers, have a center seat in tonight's engagement. You, the people, are in charge of this discussion. And so she will ensure that your questions are answered. Now, before we begin, it is important that we let you know that the Democratic National Alliance, we host this national consultation on COVID-19 as a public service. It is intended indeed to provide a robust discussion and to stimulate dialogue on this far-reaching subject. The statements made should not be interpreted as representing the DNA's policy, and likewise, the views and opinions as expressed by the panelists are those of the speakers and do not represent the views of the Democratic National Alliance. So let us jump right in. Tonight, we will discuss the public health aspect of the impact and the response of COVID-19, including vaccinations, protocols, treatments, and the management of COVID-19. Simply, Let's talk. It is my pleasure, therefore, to introduce you to an esteemed regional panel that we have for you this evening. First, let me let you know, I will read just to give you a brief background on our panelists tonight, and then you will meet them individually as they give brief introductory remarks. So I will just go through our list of panelists tonight. We have with us Miss Amina Goodwin Fernandez out of the USA. Of course, those of us in Antigua and Barbuda paying attention would know that name. It's a familiar name. And so Amina, Miss Goodwin Fernandez, is a graduate from the University of the West Indies in 2001 and practiced medicine in the Caribbean for several years. She served as this country's HIV/AIDS clinical care coordinator for a number of years before she pursued a specialty in infectious diseases, becoming then the sole infectious disease provider for the East Mississippi, West Alabama region since 2013. She is also an online health coach and teaches family medicine at Rush Foundation Hospital. Dr. Goodwin Fernandez, welcome.
Thank you.
I would also like to welcome Dr. Patrick Martin of St. Kitts Nevis. Dr. Martin is a US trained pediatrician and a certified physician executive. He holds degrees from several universities, including the University of Virgin Islands and Howard University College of Medicine, Washington, D.C. He would have completed his residency in pediatrics at the University of Miami, Jackson Memorial Hospital. Dr. Martin has served, indeed, as the medical chief of staff in St. Kitts and later became the chief medical officer of St. Kitts and Nevis during the period 2004 to 2016. He currently operates a successful pediatric practice in St. Kitts and Nevis, where he continues to speak and present on matters related to improvement of healthcare delivery, high performance sports, and public affairs. And he does so in a number of forums, including as a host on a popular talk show called Groundings. And Dr. Martin wants you to know that he enjoys jogging, swimming, and playing the bass guitar. Welcome, Dr. Martin. We're glad to have you. Let me introduce you, Antigua and Barbuda, to Mr. Loftus Durand, who is a social activist and social justice advocate from Dominica. By is an electronic technician and owns and operates a small business called Lofty Electronic Services for over 15 years in Dominica. He is the father of 2 handsome sons and 1 lovely daughter, who together serve as his motivation for his social activism. He is regarded as being the voice of the voiceless and a champion for the downtrodden in Dominica. And he does so from a platform as a radio host on a popular radio station there, 95 FM, and his own personal show called Talk on the Block. And so tonight, Mr. Durand brings the voice of the people to what may otherwise be a very medically oriented or strictly medically oriented discussion. Thank you, Mr. Durand. We have one other panelist, Dr. Roger Hunter, out of Jamaica. I will introduce him, although I must apologize to the public. Dr. Hunter is currently having some technical difficulties, but I will introduce him nonetheless, and he is destined to join us. So Dr. Roger Hunter of Jamaica, graduating from UWI in 1996, did so with the Allenbury Prize for the top student in medicine and therapeutics. Dr. Roger Hunter received as well the GlaxoSmithKline Clinical Medicine Award for the most outstanding performance in clinical medicine examinations in 1996. He was destined for great things, and Dr. Hunter is now an internationally accomplished consultant neurosurgeon with over 20 years of practice in the field of neurosurgery in Jamaica and the United Kingdom. He helped to establish the Southampton Surgical Spinal Surgery Service in London, and he did so in 2009. He also had a tenure with the National Health Service Trust of the United Kingdom, where he contributed to the establishment of the London Trauma Network, which was launched in 2010. Dr. Hunter went on to establish a computer-guided three-dimensional complex spinal surgery. And upon returning to Jamaica in 2012, he established there neurosurgical services in Portmore, Mandeville, Montego, and Kingston, where he would accomplish many firsts in that island. Some of his firsts in his practices include he is the first cervical arthroplasty, he did the first kyphoplasty, he did the first keyhole spinal fusion in a 92-year-old lady. Dr. Hunter also performed the first axiom guide awake brain surgery in Jamaica. And so he is a seminal neurosurgeon in the Caribbean and he is published local and internationally in many medical journals and have lectured at a number of universities. We welcome Dr. Hunter of Jamaica. Now, having welcomed our panelists, thank you all. I will now invite our panelists to individually just give us brief opening remarks. You are free to make those remarks on whatever you prefer. It could be introducing yourself or sharing some medical experience on COVID itself as we prepare to get into this discussion. And so I will ask, therefore, an introductory comment first from Dr. Goodwin Fernandez. Thank you.
Yes, good evening, everyone. And I'd like to thank the DNA for inviting me to be a part of this forum. And essentially, I know we don't have a lot of time, but what I want to impart, hopefully by the end of this, or what I want to achieve is to give people hope that the world is not coming to an end, and there's still a lot of power that we have as individuals to improve and optimize our health. And so we'll see what questions arise, but I'm pleased to be here.
Thank you very much, Doctor. I now invite Dr. Martin. I think it's Marks.
Thank you, and greetings from St. Kitts and Nevis. I commend the DNA for organizing this knowledge activity. Mindful of the proverb, knowledge is like a garden. If it is not cultivated, it cannot be harvested. I am honored to be invited to try to contribute to the intended harvest. In the Caribbean, we operate on the principle that our health is our wealth. Accordingly, each country has a public health system with the legal obligation to safeguard the health of the population. COVID has certainly highlighted the best performing countries. And I look forward to the exchange, and I'm now at the mercy of the moderators.
Dr. Martin, we will be merciful. I now invite Mr. Durand of Dominica to give his opening statements.
All right, well, pleasant good evening to everybody here. Let me say a special good evening to the DNA and Ms. Parker for pulling together that worthwhile activity tonight in terms of that discussion. Also, my colleagues on the panel, good evening to you guys as well. It's a pleasure to be meeting you guys virtually here to have what I expect to be a very fruitful discussion, not just for us, but for the listening and viewing public. And in terms of an introduction of myself, it was said already basically. So I'm just wanting to bring the different perspectives as to what is happening on the ground, this much talked about COVID-19 situation that has basically changed our lives from the onset of 2020 thereabouts. So I look forward to a very fruitful discussion to follow. Thank you.
Thank you, Mr. Duran. And so we will jump right in. As is stated, this is a talk session for the public. And I would like to jump off. I believe that Dr. Goodwin Fernandez would have set such a perfect stage in her brief remarks when she cautioned us that the world is not coming to an end, right? That we need not bring out the fire hoses. And so we will begin there. I know the public, some people in the public are having a lot of COVID fatigue. There are others who have not yet gained control of the fear and pessimism that they have concerning this virus. And so I just want us to begin at the beginning in terms of what is COVID-19 as a virus, and what is the real threat in your estimation, in your experience, that it poses. And that is because, as we know, we've seen some of the data which shows the statistics for the survival rate versus those persons with comorbidities and risk factors. And I think when persons are seeing the amount of deaths that are happening, they might be concerned. And I think they wish to know where they should rest any concern that they have. So that would be the first question. What really is COVID-19, and how much of a threat is it to our existence as human beings?
So thanks for that question, Malika. And COVID-19, we know, of course, it's a respiratory virus. So this is a virus that infects the respiratory tract, can be the upper respiratory like a regular cold, but then in some it can progress to the lungs. And I like to think of COVID-19 as an opportunistic infection. Opportunistic because it takes the opportunity of a person with a weaker immune system to, take hold and multiply and so on, right? We think of opportunistic, and a lot about COVID-19 reminds me of HIV, and we think of opportunistic infections there, where the germs, the regular, germs, I guess I can say germs, viruses, etc., take advantage of a weakened immune system, right? Whereas in a regular person, it does not cause much, harm, if any at all, right? So it's the same for COVID-19. It takes advantage of that weakened immune system. And when we look at the persons who, might be at a somewhat higher risk for severe outcomes with COVID-19, right? It's diabetes, high blood pressure, high blood pressure, which is hypertension, heart disease. But the common thread in these conditions, and I forgot to mention obesity. The common thread is basically being metabolically unhealthy or having insulin resistance, right? That's what we see with all these, predisposing conditions, right? And so given the fact that these, sort of lifestyle diseases, right, insulin resistance and these diseases, right, they can be prevented. And that's why I want to, everybody to know that it's not over until it's over, right? And so we can do things to halt these diseases and in some cases even reverse them. And with that, we will optimize our bodies and make ourselves the strongest possible hosts to fight this infection, right? I'll say one more thing, even though, these conditions increase the risk of severe outcomes, most people with these conditions still do not have severe outcomes, maybe 15, 20%. I don't really know the figures, but most of the patients I admit, I'm here in Mississippi, and up to last week, we had two, I admitted two, and they were older with a lot of problems, and they were fine, so just for people to know, there's so much fear going around, and that's a big part of the problem as well. But essentially, having these conditions, it increases your risk, yes, but you can do things to reverse these conditions. And also, it is not, automatic that, I'm diabetic, I got COVID, I'm going to die. And so we need to get down that fear and realize that, you know, it's not over.
Thank you very much, Doctor. I invite Dr. Martin to give remarks on that question. How much
Well,
of a threat is COVID-19?
Well, in my public utterances, I consistently make the point that it's not an automatic death sentence, that globally the statistics are clear. The average death rate is 2%, which means that the vast majority of persons who contract COVID will recover, albeit some persons have what's called AKA long COVID, but it's not an automatic death sentence. Most persons are asymptomatic or have a mild disease. The compounding factors have been elucidated by my colleague, but there are some upstream factors that we need to consider. Those are the structural and social determinants of health: what you eat, what you drink, where you live, income level, workplace conditions, your social supports, how much stress you're under. So we need to bring, to the extent possible, we need to bring those structural and social determinants of health into the picture to make the point, again, that, you know, things are preventable and things can be responded to. We now have in our toolkit safe and effective medications and vaccines. So in the ledger, there is more hope than despair.
Okay, thank you, Doctor. We will definitely get to the conversations about vaccines in terms of what do we really have in our toolkit. Before we do so, though, I invite Mr. Duran, from his perspective as a layman on the ground and through engaging the people almost on a daily basis, do you get the sense then that persons are indeed seeing COVID-19 as an existential threat? And how afraid is the general public with those numbers that were given by Dr. Martin?
To answer that question, what I would say is that having heard a lot of persons' perspectives on the threat that COVID-19 posed or poses to them, their livelihood, even their life itself, I think it is quite alarming that some persons out there, they are very much concerned about the threat of an unseen enemy.
Yes.
What I'm getting on the ground is that some persons are still in denial that this thing is still a hoax and it is all, you know, there are all sorts of conspiracy theories out there as to what is COVID-19 and what are the threats that it comes with. But separate and apart from these conspiracy theories, even some persons who are on board with the program, as it were, in terms of getting themselves more acquainted with the facts and the scientific information about COVID-19, there are still a large number of these persons who are very fearful about not just the now, but the future. Mm-hmm. Some persons, they are ready and willing to accept some of the protocols that are being put in place, the mask wearing, the social distancing, whatever it is. But in terms of the vaccination itself, or the vaccine themselves, you have that kind of hesitancy among the people. And I'm talking about the people who are ACUA, who are on board with the program, as I said before. Here it is. the challenge for some of these people really are, and I guess some of their questions and queries are genuine. Though they may have heard a lot of virologists and doctors in the field, like the panel we have tonight, explain it times without number as to the effects of this vaccine on the body and everything that goes with the vaccine or vaccinations. But some of these people are so very reluctant. And with that reluctancy or hesitancy comes the issue of they presenting themselves, that the body that is now, to even take the jab, take the shot. And even the thought of it being made mandatory between the workplace or certain business places, or even from a policy standpoint where all governments are concerned in the region, that I can tell you, it is basically not going down well with a lot of people. I know the doctors will get into the nitty-gritty of these situations later as to the why, but from a broad perspective, what I've been hearing so far from the different sectors of society, and when I say sectors, you have the people who are right up there, economically speaking, you have the middle age, you have the middle class, sorry, and also you have the barefoot man as it. Every one of these sectors of people, you have in there that level of fear that comes around with the vaccine or even the taking of these vaccines.
Okay, thank you.
It is quite alarming that is the situation on the ground, but I must be true to what I am hearing on the ground, and these are what we are hearing and seeing on the ground.
Okay, thank you, Mr. Durand. Yes, you're really taking us right to the meat of the matter. I know that is the current discussion, of course, the whole idea of vaccine hesitancy, and we're definitely going to get to that. But in your comment, you also mentioned the whole protocols and the mask wearing. And I would wish to engage the doctors on those protocols, those public health protocols that have been put in place, because there is still some level of resistance. And particularly when some persons are looking at the data and feeling, as has been expressed tonight, that COVID-19 is not a death sentence. And we know that there are often comparisons made between COVID-19 and the common cold. So I would wish us, just before we get to vaccines, to just have a discussion about COVID-19 versus the common cold, and whether or not, or to what extent, the protocols necessary. However, before we do, my co-moderator is nudging me. I think the public is already ready to jump in to the discussion. So I'll turn over now to Shinil.
All right, good evening, everyone. It's a pleasure to be here as usual. We have one question coming from Alvin Samuel on Facebook. And before I go into the question, I'd just like to remind our viewers that they can ask their questions in the comments down below, and they could also send a private message to any of the DNA social media platforms if they'd like a question to be answered. All right, so into Alvin's question. Alvin asks, for those who have contracted the virus and survived, what will the vaccines do that your immune system cannot? I can repeat, for those who have contracted the virus and survived, what will the vaccines do that our immune systems cannot?
Okay, so Alvin as well has jumped already to vaccines. I will let the doctors answer that question, and we can come back to the one I posed concerning the comparison of the viruses.
I guess I can give an answer, since nobody else is volunteering. And I think the answer to that is that, we don't know. It's still early at this point. In the pandemic, relatively early in the pandemic, the vaccines have been rolled out, and we absolutely know of cases where people are reinfected, within 6 months of vaccination, right? Now, in terms of people who naturally got infection, we've heard of cases where people with natural immunity from infection, they have gotten infected as well. So I think, in my opinion, I think it's too early to tell if the vaccine immunity is superior to natural immunity. Now, of course, you're probably going to hear opposite of that, depending on where you listen or who you listen to. But I think the fact is it's early and we're still looking at this thing, looking at the data, studying it, and I just think it's impossible to tell.
Dr. Martin, would you like to get a bite of this?
The common cold is caused by over 200 different viruses. COVID-19, as best we know, is caused by one virus, a new virus, new to the world. Therefore, all are susceptible. And since Delta, all are exposed. And all are potentially infectious. I use the term potentially because we are learning as we go along. It's now 21 months into this pandemic. And it is clear that science is not perfect, that this is a test match, not a T20, and that whatever has been settled in science, it is what it is. I could say here in St. Kitts and Nevis, so far, well, up to yesterday, we have 60% of the vaccine eligible population fully vaccinated. I put that in now because there's in public health, there is the absolute need for effective communication. And in a crisis or emergency situation, one has to rely on the principles and practice of crisis and emergency risk communication as promulgated by UN agencies and the US CDC. This is a skill that I, as a former chief medical officer, had to learn. Did not learn this in medical school, because in medical school you're taught to communicate one-on-one, one doctor to one patient, whereas in public health is one to population. So the communication surrounding the virus, the disease, and the non-pharmaceutical and pharmaceutical measures is very, very clear. It's not what you say, but how you say it and who is saying it. People listen to people they have an emotional connection to. And sometimes that person is not an MD. Sometimes that person is a political leader, a pastor, a DJ, a social activist, etc. Right? So we have learned that here in St. Kitts and Nevis, and I've seen from the data, the research, where people are realizing this is a team effort. No sole reliance at all on the medical profession to get the message out.
Okay, thank you, Doc. And so you as well, you have now opened the whole question of vaccine hesitancy and how do we communicate to the public. Again, we're gonna get to that, but I just would like for Dr. Goodwin Fernandez to take a bite out of that question, because I think that is really some of the meat of the matter, where there is this sense that COVID-19 is manageable. There is information out there that the common cold, just like the common cold, it is treatable, and so on and so forth. What, in your estimation, on your opinion, your experience, your professional opinion, is the difference, Dr. Fernandez? And then we can move on.
The question is about the difference between COVID-19 and the common cold.
Correct.
Oh yeah, it's a more, I guess we could say, virulent. It causes more like dramatic like manifestation of disease in the body, right? So whereas a common cold, you know, you mostly don't have a fever at all. This, you know, it's kind of similar to the flu in terms of manifestations, right? Where you get sick, like you're down in bed, you have a high fever for days sometimes, and then, you know, some viruses, common cold is mild, but like influenza and this one, and there's like adeno and all these types where they can actually go on to cause these like responses where you have all these chemicals produced in the process of fighting the infection, we call them cytokines, right? And then it just escalates out of control, and then you can go on to get a dramatic pneumonia, just a lot of inflammation in your lungs, etc. So something about COVID, I guess, you know, this SARS-CoV-2 causes it to be, I guess, the makeup of the virus, it's more virulent, it causes more dramatic disease compared to a common cold. And like I said earlier, it is opportunistic in that the more dramatic disease happens in those who have these chronic illnesses, these metabolic conditions, diabetes, obesity, hypertension, and so on, whereas a common cold is really, for the most part, not going to affect persons, you know, metabolically unhealthy in that way. So that's the difference. It's just a more virulent, meaning a more disease-producing virus compared to the common cold.
Very good. And so then we can move on from there, before we get to vaccines though, to just dwell a little on the whole question of the variants and the fact that we have seen COVID-19 in the last 18 to 19 months change in dramatic fashion. The current variant of discussion is the Delta variant, and I think there was a mu that came out shortly thereafter. I would like the doctors, therefore, to enlighten the public on what is a variant and why is the Delta variant now, as is being reported, causing so much havoc, including widespread death at this time. Dr. Martin.
I have not seen any data that the Delta variant is more deadly. The Delta variant infects more people, and so 1% of more is a higher number than 1% of less. Viruses, well, all germs, let's use a term, germs, have the ability to change genetic material. This is natural, this is not new. But what is new is that the virology, immunology, genetics have been thrown on the general public in a tsunami. And so it appears as though the sky is falling in when we talk about variants and stuff like that. But we are to expect variants with this one and, heaven forbid, the next one.
Heaven forbid is correct. Dr. Goodwin Fernandez, would you like to comment on the Delta variant? Dr. Martin has shared just a little a nuance there, that the Delta virus is not indeed more deadly in terms of the data he has reviewed, though it may be more contagious, its ability to affect more people. Would you like to comment on that or expound on that?
Yes, I just wanted to talk a little bit about variants and how they arise. I guess expound or elaborate on what Dr. Martin said, because one of the things that has been a little distressful is just the whole thing of blame, which blame is never good. It's never helpful to anybody. But I know, you know, persons who are not vaccinated are being blamed for, I guess, the continuation of the pandemic, right? And again, I like to compare to HIV, right? Germs in general want to survive, right? And bacteria, viruses, etc., they will try, if we try to bombard them, like, I guess, kill them, eliminate them with whatever man-made things we come up with, antibiotics, antivirals, vaccines, etc., they will try smartly to change up so that they can escape these interventions that we have, because we want to survive, but they also want to survive, right? So, like, talking about this one, the COVID vaccine specifically, COVID virus and the vaccine, right? So we have vaccines, right, that we have basically rolled out to the entire population, right? And I guess there's debate on whether that's the right thing to do or not. But anyway, we rolled it out to the entire population. And so we have a lot of people who are infected, right? And then you have partial vaccinated. And so the virus is coming in touch partially with some amount of antibodies, but not fully. There's not this full, protection from vaccine in the population yet, right? So the virus is able to now interact to an extent with the vaccine, a little bit, not fully, because we don't have full protection. And so it is able to learn and say, oh, I'm going to change up in this way to escape the vaccine because I want to survive. And so whereas, I've heard people say, oh, the unvaccinated people are the cause of the variants. The variants form in vaccinated persons. And I know it's so confusing for people again, because even people from the top organizations are saying that, right? But if you just look at it and just look at nature itself and you realize, germs want to survive too. And variants or mutations, just like with HIV, mutations do not happen unless if somebody's never treated with a drug and they have a bacteria, the bacteria is never going to get a resistance mutation. Same with viruses. People with HIV, they just have wild type virus, they've never been exposed to antiretroviral medications, they will never develop mutations. Hit them with one of the antiretroviral medications, just one, so it partially suppresses the viral replication, then they will start developing mutations, HIV mutations. Same way with COVID, right? The SARS-CoV-2, right? You have it interacting with partial, antibody levels. And so it's able to change, mutate, and escape. And so we have all, variants, I guess, Delta and whatever other variants are forming. And that's what's going on, right? So, I'm not a policy person, but, theoretically, in the early stages, when you're still trying to learn about the virus, all the details and so on and so forth, sort of saying, okay, we're going to do, those super high risk people, and they're probably not really out and about with the public anyway. And so you sort of have them, I guess, in a sort of bubble, fully vaccinate them, right? And so you have containment, of them, and you don't have the virus, which is circulating in the world, I guess, in society. You don't have that virus getting the chance to mingle with partial amounts of antibodies and then getting mutations, right? So I believe, from my knowledge of, infections and germs in general, that, mutations only happen when the germs are exposed to treatments that we, supply to try to kill them, basically.
Thank you very much. But Doctor, I think we will have to dwell here for a little, because you are indeed correct. And I will also go to Mr. Durand in terms of the layman on this panel, because most of the narrative that we have been hearing is the opposite of what you just explained. That indeed it is being said that it is the unvaccinated persons who are causing the variants to pop up. And the more the population remains unvaccinated, the greater the likelihood of more virulent variants coming to the fore. You're saying the opposite is the truth. I'm wondering if Dr. Martin would also like to comment on this.
This is my consistent statement during my talk show. The higher the level of population immunity, the lesser the number of persons available to become infected, and the less is the likelihood of emergence of new variants. So that is the short spiel. I also support the view that blame is counterproductive so too is stridency from the medical community and from political directorates and others. People have genuine concerns, and it is my experience that when these concerns are addressed on one-to-one in a respectful and empathetic manner, you are more likely to get a favorable response. Also adding to that, the unmistakable, undeniable value of social influencers, non-medical people, people who people listen to, talk show hosts, pastors. I've been down the list before, so I will not repeat that. So this aspect of communication, I think we're onto that right now. This aspect of communication is a critical factor. But for us in the Caribbean, we have to make sure that the communication is culturally aligned with our context. I'm of the view that bad news networks from foreign have done a number on our people. Got out ahead of the authoritative information from home. Because here at home, we have hundreds and St. Kitts and Nevis is a population of 50,000. We have thousands who have benefited from our vaccination program, which has been in place since the late 1960s. Likewise in Antigua, Barbuda, throughout the Caribbean. We have thousands, hundreds of thousands when you add up the whole Caribbean. Yet, the disinformation networks got a foothold. We have to continue pushing back against that, and that is part of my obligation on my talk show.
Thank you, Dr. Martin. We're going to come to you, Mr. Duran, in a minute, but our message board is heating up. I just want to remind our listeners that the DNA is facilitating this discussion as a public service, and we are encouraging diverse views. Like we say, let's talk it out. All right. So I will go now to the co-moderator who has some interventions from the people.
All right, so we have a second question from Alvin, and I think Dr. Gudrun Fernandez would have touched a bit on it in her presentation previously, but the question asks, the variants are mutations from my understanding. Before people were unvaccinated, there were no variants. Am I correct to assume that the variants came from unvaccinated persons who have contracted the virus? I think that this question could have been addressed in what Dr. Goodwood would have said. Alvin, you can let us know in the comments if the answer that you would have received in Dr. Goodwin's comment would suffice. If not, we can always come back. We have a second question. I'm trying to find it. We have a second question from Craig Joseph, and he says, good evening. When will mask wearing come to an end? What will have to happen to end the wearing of masks? That is Craig's question.
Thank you, Chanel. I think that is a good question. Any one of our doctors can take that, and then we'll jump right into the conversation about vaccines. When will mask wearing end? Will it ever end?
I would say that I guess mask wearing will end when the people in charge say that it can end. You know, where I am, we wear masks in the hospital with our patients, but going out and about, you know, there's no requirement. It's basically a personal choice. I think I have not been a firm believer that a cloth, you know, like some people say, oh, what's wrong with a piece of cloth over your face? And in my opinion, it really doesn't do much. Maybe it gives some false sense of security. I think the most important thing to do if you want to try to avoid or prevent infection is to minimize, you know, crowding, especially with people who you don't know, and also minimize the time spent in these crowded environments. So sometimes you might have to run into a store, you know, in and out. But if it's just 5-10 minutes, then that's, in my opinion, not going to pose any enormous risk compared to if you're in an indoor, you know, like, I don't know, maybe a cinema and it's jam-packed with people and you're going to be in there for 2 hours, then, you know, you might have a high risk of acquiring infection there. But, you know, the mask, I think it's you know, we see, I have older patients and they come in with these masks and they're so, you know, dirty and things like that. So I think, I don't know how much good it's doing to wear a really, really dirty mask, right? Which for old people, they have their different deficiencies, and you know, like they're just trying to follow the rules and they, you know, but it's like a rule blindly, and I'm not blaming them. It's just how the system is, just has everybody so fearful that, you know, and believing that this thing is, you know, going to help them. And I think it's, you know, misguided. It's these thin pieces of cloth, space everywhere. I mean, if this virus, when we go into patients' rooms, we wear an N95, which obviously is what really blocks the germs. But for cloth face covering, I would hope that, you know, most people do away with it for the most part.
Dr. Goodwin Fernandez, I have to tell you, in these parts, that is blasphemous.
Well, I know, and I know a lot of what I'm saying is sort of completely opposite from like what I guess the common feeling is, but you know, just yeah, that's just my personal opinion.
Right, and it is really, we've had interventions here from many, many, many medical professionals, and of course, the emphasis is always, it is now a social responsibility for all of us to encourage that the protocols be observed, which of course includes social distancing as well as wearing masks, which the concept of that is that you will reduce the ability for your own droplets to spread, as well as the droplets of others making contact with any of your, you know.
Yeah, but even in, oh, sorry to cut you off.
No, that's fine, please.
I was going to say that the rule gets really extreme when you're going to have it as outdoors, like you're on the street outdoors and you're going to be fined, you know, $500 because you're walking around outside in the hot sun, like you're in the tropics. I mean, masks are not without their, you know, potential, you know, side effects, I guess. You know, some people have a lot of sinus issues, facial rashes and so on. So to just do something just because, you know, I think we have to have like proper reasons to do something, not just because. And at this point, those who want to be vaccinated, you know, have been vaccinated. I mean, some people, you know, might decide, well, I'm going to take my risk, you know, whatever, if that's a good decision or not. But I mean, just to have a cloth face covering, you know, just, oh, what's wrong with a piece of cloth over your face? Just because it's a rule, like it has to make sense, you know? And
okay,
so
I can see our message boards lighting up, and I know that the communications officer is probably itching to come in, and we have to move on to vaccinations. But would Dr. Martin, do you care to comment on this issue of face masks that our viewer has a here?
Well,
can move to questions.
Well, if in the face, in the midst of the throes of a respiratory virus, a virus spread by coughing, sneezing, speaking, etc., what is public health to do? Well, public health will do what is known to work, and that is seek to interrupt transmission between persons. And a mask that, all masks are not created equally, I accept that, but a masks that have demonstrated utility in interrupting transmission are highly recommended. And so my advice.
What masks are those, Dr. Martin? Because
well, the N9, there are masks that are labeled N99 and N95. Those appear to be at the top of the food chain. But my advice to persons is this: wear your masks where 2 or more are gathered and distancing is not possible. especially indoors, and in air-conditioned environments. Outdoors, in our warm, salty environment, near the ocean, in the sea, no.
Okay, well, our public health officials and certainly our governments don't agree with that, but I will go now to Mr. Durand and ask him, how does the man on the street feel about that issue?
Well, what I want to ask the medical doctor here, even before we move forward, and I'm asking that based on the premise that some of the policy makers in the region have already drafted regulations to mandate persons wearing masks in the public space, as Dr. Fernandez alluded to earlier.
Right.
What I want to ask the medical doctors tonight, before we move forward, is whether that virus is airborne. And I say airborne meaning not just how the doctor a while ago said in terms of close proximity to other persons. For example, I'm seeing persons, for example, exercising in a very lonely park. They're alone, and they have a mask on their face. That question to the doctors, whether that person in that open space by themselves, whether they can contract that virus through that way.
Okay, thank you for that question, Mr. Durand. We're going to come back to our doctors, but now we're going to allow the communications officer to also pose some questions. Maybe they can take 2 or 3 of them at the same time. Go right ahead, Shima.
All right, we have a question coming from Louis. Does our immune system battling COVID cause it to mutate also without the vaccine? That is a very interesting question. Would any of the doctors like to take that on?
Dr. Fernandez has spoken on that. Anything we throw, every time we throw something at a germ, the germ tries to evade it. That something could be from within or from without.
And so the inverse is true, which is what I'm getting from this question, that if you're not throwing anything at it, and Dr. Fernandez really did say that, if you're not throwing anything at it, if it's just your natural immunity, are we saying that it is less likely, therefore, to mutate? It may.
Yes.
Right.
I was going to say that mutations happen normally, right? You have these low-level mutations, just little minor things. But then if you are concerned, just non-specific, but then mutations to treatment or for the germ to be resistant to treatment would have to happen when the germ has come into contact with some amount, like a low-level amount of the treatment. So yeah, you always have mutations, but the serious sort of more, the ones that we would be concerned about would be in response to contact with treatments.
Thank you very much. You're still on the floor.
All right, awesome. We have a question here. Did I lose it? Yes, we have a question here from Nicole Martin. And Nicole is asking, what information can you share about early treatments?
Anybody? Okay. Well, here we have a big program where we provide monoclonal antibody infusions, and we really believe that it has helped. I don't know if it's placebo or what, but it looks as if the monoclonal antibody infusions help persons we give it prophylactically for people who have been exposed, and also early for people who have early infection, mild symptoms before they get to that point where they have, profound pneumonia and so on. And so that is one treatment available up here in the United States. And then also we have some people are not eligible for it. So another treatment we give straight up is steroids to help blunt the inflammatory response. Steroids are anti-inflammatory. So we don't want the body to generate this hyperinflammatory response, which tends to happen in the second week of infection. And so we give everybody who we admit they get steroids as well. And then we have an antiviral. Some people, it's called remdesivir. I believe they have that in Antigua as well. I'm not sure about St. Kitts, but that is available for some people who are eligible, depending on their clinical situation. So the main early treatment is the monoclonal antibodies, and I'm not sure if the Caribbean islands have that. And then the second one is steroids.
All right, excellent. Thank you so much for that. Thank you so much for that answer.
Before you ask the next question, Chanel, Doc, I just want to put our doctors on notice that I will ask about ivermectin in terms of an early treatment. We don't use it here in Antigua and Barbuda, and I think in a number of Caribbean islands, but I just want you to register that, and we will come back to it. Chanel.
All right, excellent. Thank you. And I noticed that Dr. Hunter has joined us as well. I noticed that Dr. Hunter joined us. So good evening, Dr. Hunter. Thank you. We are about an hour in, and we are taking some questions from the floor right now. Right. So Alvin would have asked another question, but I think this is another question that both Dr. Fernandez and Dr. Martin would have addressed, but just for the general public who would not have seen it, it's too big to show on the screen. He asked about the mask wearing and rebreathing our own CO2, and if you could shed some light on that. Anyone, don't all answer at once.
No, but I think we covered that one already. I think that's why there's a little silence.
Well, masks are worn in the medical context, surgeons, and there's no problem there.
All right, awesome. Thank you so much.
And there's our surgeon just joined us, so he's been wearing masks. He's been wearing masks since infancy. Sorry, I like to infuse some humor because there is so much stress that without the humor, my gray hair will turn grayer.
And I know. Thank you for that. The DNA is a big proponent of the mental health aspect of this pandemic. And I agree that we must find some way to smile. Camille, do you have more questions for us, or can we move on and therefore ask Dr. Hunter to just give us brief opening remarks?
We have one more question. It actually came from our Instagram feed, and we also have another one from Alvin. I'll give the one from Instagram. The person on Instagram asks if there are any mental health comorbidities of COVID-19 that we know.
Interesting indeed.
Something just came the Lancet, a recent Lancet publication, studies done in multiple countries showing that depressive disorders and anxiety disorders have increased by 20-25% worldwide. I could certainly vouch for that in St. Kitts and Nevis from an observational standpoint. So is the stress? Is the COVID is such a lesson for us. It has really brought us back down to earth with the need to consider the whole person, the spiritual, the social, the mental, and the physical aspect of the person, his or her family, community, country, and the world, which is not how I was trained in the Western model several years ago.
Right.
So I've had to learn that.
Thank you very much, and thank you, Dr. Martin, for that little bit of truth there at the end. So I want to invite Dr. Hunter now. We're happy you were able to join us. We did let the public know that you were having some difficulties. So as Shini would have said, we are more than an hour in, and I think I would give you the floor as we begin this conversation proper about vaccines and vaccination. The question I would ask you is this: we have many vaccines on offer. In Antigua, there are at least 5 vaccines. And so daily, the cry is get vaccinated, get vaccinated, get vaccinated. What is the difference between the various vaccines that are out there and are the fears that the public have concerning vaccines true for all of the vaccines in terms of, the vaccine injury, so much that we read about Pfizer and Moderna? Are they true for all the vaccines? Dr. Hunter, welcome with that question.
Thank you. Good afternoon, everyone. It's good to be here, and thank you to the host who especially invited me here. It is true to say that anything that you take into your body, including vaccines, can definitely produce side effects. The argument was never that vaccines will not produce. The argument was about risk benefits. How much more will you get a benefit compared to the risk from the vaccine? Well, that question cannot be properly answered because there are unknowns about the vaccine. Why do I say that? We don't know what will happen in 20, 30, 40 years from now. So there is an element of uncertainty surrounding the long term side effects of the vaccine. But in terms of the short and medium term, we have seen short term side effects of the vaccine, such as a stroke. We have seen that in Jamaica locally. When I say the vaccine, I'm referring particularly to the AstraZeneca vaccine, which became first available locally in Jamaica. Since then, we have had the Johnson & Johnson single-shot vaccine, and I see where Johnson & Johnson is pushing for it to be combined with other vaccines. And of course, we have had a limited edition of the Pfizer vaccine, and the Moderna vaccine is nowhere to be found in the Caribbean. Well, certainly not in Jamaica. But we must be balanced in terms of how we look at vaccines because they're not just made out of the blue. They're made in the context of trying to combat a very terrible disease. And the origins of that disease is still yet to be disclosed. It's still yet to be discovered exactly how this particular infectious agent came about. And I deliberately chose my words there because I'm not so sure it's a coronavirus per se in a classic natural biologically evolving sense. But I'll leave that aside. The COVID infection causes a lot of complications for people within the Caribbean and within the hot tropical zones, and particularly people of the Caribbean who suffer from NCDs, the chronic non-communicable diseases, such as diabetes and hypertension, obesity, high cholesterol. And these are really amongst our number one killers. And the Caribbean has one of the highest prevalence of these diseases in the world per population, per capita. So the COVID vaccine, yes, it will have risk, but the risks have to be weighed against the particular individual's risk of the disease. Now, I got COVID treating my colleagues, and one was 104 years old and the other one was 71 years old. And I treated both of them early, and they both lived. About 4 days later, I developed a fever. I know that was unusual for me. I measured my temperature, it was 101 degrees Fahrenheit. And so I immediately knew that was started treatment early. One, I went to bed, I rested, I hydrated, but I also used interleukin 6, Actemra, toxicilumab. I used remdesivir. I even used acyclovir, as well as I used Xarelto, blood thinners, and dexamethasone as well. I also use supplements, vitamin D, E, C, zinc, and caltrate D. These are very important supplements for our immune system. So the disease process for me was not particularly terrible. I would say that some will say that I was severe because my O2 sat well went to 79%. I stayed at home and treated, and I was able to overcome the disease at home. I certainly was not looking forward to going to a government hospital or a private hospital for that matter. but private hospitals simply, except Bay West Hospital in Montego Bay, they simply were not taking COVID patients. So the disease itself for me and for my 104-year-old lady and my 71-year-old doctor, it was a significant disease. And you could say, yes, we're bordering on the severe category. But with early treatment, including ivermectin, including steaming, including oral hygiene, we were able to turn this process around. What we have not heard much of throughout the dialogue, whether here in the Caribbean or in North America or in Europe or United Kingdom, we have hardly heard anything about early treatment. And that is really, really sad. Caribbean people are not averse to vaccines. We are one of the most highly vaccinated regions in the world. I think we are polio free and we are measles free. We are not averse to vaccines. We're a little bit cautious about a vaccine for a virus that always changes. What people of ethnic minorities like ourselves hate, we absolutely hate the fact that you don't treat us. We hate to be left for late. Like in the Tuskegee experiment, the whole disaffection of the Black American experience from Western medicine had nothing to do with vaccines. It's quite the opposite. They wanted treatment and did not get it. They were told they were being conducting an experiment on syphilis. Penicillin, the treatment for syphilis, was discovered. They held back penicillin from those Tuskegee airmen and their families and their wives, and watched syphilis evolve from 1932 to 1972. These were experiments carried out by the CDC, doctors, medical doctors sworn to the Hippocratic Oath, and they carried out this unspeakable experiment, withholding treatment from people, from black people. And the result was that wives got syphilis and children were born with congenital syphilis. So the amount of money that certainly in Jamaica that has been spent trying to market vaccines and trying to convince Jamaicans to take the vaccine, I think it's really misspent, really. It should be better spent on our health systems in the primary problems, getting CAT scans at every parish hospital, getting more nurses and doctors to stay within the public system, getting basic drugs. Today, I was struggling to find a drug called furosemide, which is Lasix. It's a water tablet. Yesterday, I was struggling to find a drug called midazolam to prevent seizures. We are really in a major crisis, and COVID has just exacerbated the crisis. So, yes, vaccines are relevant. They are a part of the strategy to get over COVID. But there are fundamental problems with healthcare that must be addressed. We had Chick V and Zig V to address these, but yet they were not addressed. And now comes COVID, and everything is shut down. Children, over 200,000 children have been left without school. Yet those who are taking CXC can go to class and take CXC, which is absolutely ridiculous and appalling. But 200,000 children have been left without school under the guise that they're protected using the measures of lockdown. Now, I am saying the money has not been well spent. It should be spent on primary problems of the society. Diabetes mellitus, number one killer of Jamaicans last year. And guess what? It is the number one killer this year. Cardiovascular disease, stroke and heart attack, the number two killers of Jamaicans. Also, hypertension related diseases, hypertensive heart failure, number three killer. Cancers. So we see COVID is not our top four or top three killers in Jamaica. Yes, we have had nearly 2,000 Jamaicans die over 2 years from COVID, but there are other rip-roaring problems. The vaccines are not enough. We need more than just the vaccines. Last Sunday, I lost my uncle-in-law who is fully vaccinated with AstraZeneca vaccine. I lost him to COVID. And there was a nurse from KPH who is fully vaccinated, the Kingston Public Hospital in Jamaica, and we lost her to COVID, fully vaccinated. And in the UK, most people who are dying from COVID are fully vaccinated. So we welcome vaccines, but they are simply not enough. One personally would never mandate a vaccine because there is simply no vaccine indemnity. Until there is vaccine indemnity, then I think it would be absolutely abhorrent and immoral to mandate vaccines at this time, coupled
Thank
with
you.
the fact that nobody knows in 5 or 10 years what will be the long term outcome on our primordial glands or spermatocytes and our oocytes, on our ovaries and our testes. These are just these are just a little fraction of the many concerns later on. But
Thank you,
you
Dr.
have said a
Hunter.
lot, so I'll yield
You
that to you.
have your opening. You have been missing from the panel, and you really gave us a mouthful and many things that we'll try to discuss, deconstruct in the next 30 minutes. But for now, our message board is lighting up, and so we will let Chanel take over and ask some questions.
All right, thank you so much. We have question number 4 from Alvin. This question cannot be answered by our panel, but we hope in the rewatch of this live video that somebody can shed some light on the question that's going to be asked. Alvin asks, was remdesivir used at Mount St. John Medical Center from the onset when COVID-19 hit, and were there any serious side effects as a result of the treatment? Now, once again, that's not a question that our panelists can answer, but hopefully once this is rewatched, we hope to get an answer for you to that, Alvin. So thank you for your question. Second question coming in from Craig. Craig asks, based on the survival rates, is COVID-19 a genuine pandemic, considering the treatment is symptomatic care and recovery in most cases does not require medical intervention? Now, before we get the answer for that question, I just like to reiterate that the DNA is hosting this national consultation on the COVID-19 pandemic as a public service. It is intended to provide a robust discussion and stimulate dialogue on the subject. The statements made should not be interpreted as representing DNA policy. Likewise, the views and opinions as expressed are those of the speakers and do not represent the views of the Democratic National Alliance. So, would anyone of our doctors like to take this question?
Yeah, the pandemic, basically a pandemic is a new, disease that has taken over the entire world. It has nothing to do with whether or not, let me see the question, with whether or not it's treatable or how you treat it. You can have a pandemic that's not very deadly. So that's not how you look at pandemic.
Thank you so much, Dr. Goodwin Fernandez. Do you have any other interventions on this?
Me?
No, any other, Dr. Martin, Dr. Hunter, anyone else?
I can
I see Dr.
what I can
Hunter.
say what I can say about remdesivir is that I have used it personally. I've used it on my patients, but we try to use it early. And all the patients that I have treated early with remdesivir, they have lived. The difficulty, however, is that if you catch somebody late, then yes, the outcome is not as good. And late is defined by not a month later. Well, late is defined as after 5 to 7 days. So you have a very narrow window within which to use remdesivir. In terms of the pandemic, there are many pandemics that are operating as we speak. The diabetic pandemic, the hypertensive pandemic, the pandemic fed mainly by westernized foods. I think people need to pause a little bit and think about what's happened. Which country in the world has suffered the most? And which country in this region has suffered the least? And you start to develop an idea that this corona, this COVID disease tends to follow the Western diet, one of excess, one that eats perhaps late and eats 3 4 times a day. But if you look at Haiti with 11 million people have only had about 600 COVID deaths, whereas North America, with the United States of America, has had the most COVID deaths in the entire world, with arguably the leading technologically advanced healthcare system in the world. And they have always prided themselves with having a public health a robust public health response mechanism. But here they have diabolically failed. So there is something, a lot more messages are being taught to us by this COVID pandemic. And that message really lies in what we are eating. How can we get back to healthy habits and stay that course going forward?
Well, thank you so much, Dr. Hunter. Our next question comes from Jalen Turner. Jalen, I hope I am pronouncing your name correctly. They're asking, good evening. Are any of the vaccines made with aborted fetus cells? Also, how does a vaccine affect an individual in triggering health issues of the sort such as high blood pressure, etc., resulting to see or complications? Not sure what you're trying to say there in the end, but what I get from the question is they want to know two things: are any of the vaccines made with aborted cells, and how does the vaccine affect an individual in triggering health issues? So those are the two questions from Jalen Turner.
Nobody's talking. I'm not sure
Oh,
about
I'm so
all
sorry.
the.
I did not realize that my mic was muted for a little while there. So I'll just repeat the question. Jalen
No, I heard
Turner,
it.
you heard me?
Yeah, I saw it. Yeah, I was gonna
Okay.
say that I don't know about the answer with the fetus cells, right? In terms of triggering health issues of any sort, such as high blood pressure. I think the whole thing with risks for vaccines would be, more long term, maybe if there's sort of overzealous antibody responses in the future and so on. In terms of things like high blood pressure and diseases like that, I think only time will tell. And initially, like the short term evidence, I guess, like basically only time will tell. We need time. Yeah, we don't know all the details.
All right. I think that is fair. Uh, Isaac Goodwin is asking, can we actually see side effects from vaccines years after taking? And I think he would have just addressed that only time will tell.
Time will tell.
Right?
Yeah.
All right, excellent. So we have quite a few questions. So I'm just going through some of them that may not have been addressed in the interventions from our panelists. So I'm scrolling. There should be another question here. Someone asks, where is it now? Yes, Lily is asking, do you advise all persons to get vaccinated against COVID-19? Why or why not? And I think this is a question that could probably be answered by all of our panelists tonight.
And I think Dr. Hunter already mentioned his view on that, and I absolutely I agree with him. I think you have something, it's so early, and you don't know the long-term potential effects. You absolutely know that young people have minimal, like less than, I don't know, 0.1% risk of death and severe outcomes. And so to subject young people and also healthy people to vaccination when you just don't know. People can say this, that, the big authorities, international authorities can say all kinds of things, but the fact is we absolutely do not know. And then the other thing as well is that now we know that vaccination, it decreased. Basically, the selling point is that it, and I'm not anti-vaccine, by the way. I like, my son got all these vaccines earlier this year, and so on. I got all mine. So I'm definitely not anti-vaccine, but you just have to look common sense wise. And so you have people like, getting all, we know that the vaccine basically decreases, right, illness. We see it in the hospital where the severity of the illness seems to be decreased. But then, as Dr. Hunter says, and as I have seen as well, there are some people who end up dying after being fully vaccinated, right? The other concern as well with vaccination and it being, people being infected, being able to be infected after vaccination, is that being infected but not being symptomatic means that you are in the community and spreading, right? Obviously, people are not vaccinated, they can spread too, but they have a higher chance of actually being ill and in bed. So they are going to be separate from the community compared to compared to somebody who feels good, fully vaccinated, feeling confident, but they're shedding maybe just as much virus, if not maybe more in some cases, right? unvaccinated person, right? Just last week, like I was on call, and one of it actually week before, and we had somebody who fully vaccinated and he's still going to work, right? As a sheriff, and it's not his fault. I'm definitely not blaming him. He had 6 negative COVID tests before his tests finally came positive, right? And this was after a week. He kept having fever every day, but because they told him, well, your COVID test is negative, and oh, you were fully vaccinated, 5-6 months ago, whatever. So he felt like, I'm not a risk to the people who I work with, and so I will continue to go to work. Now, maybe, because he had fever, I would say for anybody who has symptoms, especially fever, you probably shouldn't, go and mingle with society, with the community, even if your test is negative, right? But we see so many deficiencies like COVID testing, negative tests, and yet somebody ends up after the 6th test, a week later, finally with a negative test. So I think so many unknowns, right? And then the whole risk of people being able to spread infection because they're asymptomatic and they feel good enough to go into society, as opposed to being sick in bed, so you're not a risk for the community. So I don't think so. I think high risk persons, vulnerable, older, obese, and not harping, making persons feel bad. But, if you're in that category where you have these metabolic diseases, then, you might want to consider getting vaccinated. But to blanket, say, everybody, including children and totally healthy people, and we don't know the long-term effects, and we don't know how effective the vaccine is, that's just not right. It's just not right.
Right. Thank you so much. Dr. Martin, I'll unmute you in 1 second. There you go.
Thank you. It is not right and proper to roll out any medical intervention without it going through the established trial process. We in public health have learned how to interrupt transmission of certain diseases, starting from the plague. And we lean on our history, our tradition of best practices. And those best practices are certainly being leveraged for the SARS-CoV-2, which is the cause of COVID. So I am confident that tried and true public health measures, informed by the sciences of immunology, genetics, virology, etc., continue to help us and will help us for the next, heaven forbid, problem that we have. Just a point about fetal cells. Persons who are listening and watching can log on to Google fetal cells and vaccines, and you'll get a list of vaccines that have been developed using fetal cells. I am aware that Public Health England is reporting that at the end of August, 100,000 deaths were avoided because of vaccines. In the United States, it is 140,000 deaths avoided because of vaccines. But I want to go back to a point that was elucidated by colleague Hunter, that it is a mistake to go down the vaccine road only. In public health, it's about a toolkit of interventions. It is also a mistake to believe that a doctor, medical equipment, and fancy hospital rooms can give you health. Health is determined by what you eat, drink. You know the 9 yards. It's already been elucidated. Workplace conditions, the amount of stress you have at home and in the church. So we went through the structural and social determinants of health, which are about 85 to 90% of health. The other 10 to 15% have to do with genetics and persons like myself who are trained to look after people. So Hunter's right. investing only in hospital infrastructure and those things will not give us health. The United States proves that. $8,000 per capita for health compared to 1,000 here in St. Kitts and Nevis, and we have the same life expectancy and same infant mortality when you compare their black population to our population here in St. Kitts and Nevis and in Antigua. All right, and the Cubans have proven that the research emphasis has to be in the community where people are born, where people are conceived, developed in utero, born, raised, live, work, play, and retire. That's where the investment emphasis has to be. I'm not downplaying the importance of hospital. I need a hospital when my heart goes pitter-patter, and I need a top-up. Hopefully there's some Lasix, and hopefully there's a nurse. But COVID has certainly identified which countries are well-run, and by extension have effective public health systems and also hospital systems. So let me finish. I might take 2 hours. Problems have predated COVID. COVID has just exacerbated them. By the way, St. Kitts and Nevis, we have, at last count, 50% of our adults obese. And in my pediatric office, I'm looking after 9-year-olds, 150 pounds, which is just about 1 or 2 pounds less than me.
All right, thank you so much for that, Dr. Jonathan. And we have quite a few more questions here. Ashanti is asking, why are they pushing the narrative of all deaths being COVID-related instead of being completely transparent with the public?
Well, you have to. I usually put that question, I usually deflect that question to the people who are saying that.
That is fair enough. Does anyone else have an intervention on this question? Dr. Goodwin Fernandez? No? All right, excellent. Thank you so much. Okay, we're getting there. We have quite a few more questions. This one I think was addressed earlier as well, but just to say that we see you. John would have asked earlier, can anyone really say that they know the long-term effects of any drug? What is the long-term effect of taking insulin or any of the high blood pressure pills or Lasix? So I think that's more of a rhetorical question.
The answer is you find out when you get to the long term.
Right.
And also another thing is that we should try, now, the common thing is to relinquish control of our health to, the healthcare system and so on, but I think we need to take back control of our health and know that there's a lot we can do. Dr. Hunter talked about how we eat and so on. We're not eating well, and with even in the Caribbean, all these fast food places, all these processed chemical additives and so on, we cannot be healthy if we are inputting, if you look at food as fuel, if you have fuel that does not burn clean because it has all kinds of additives and fillers and junks and chemicals and hormones and preservatives, you cannot be healthy because your body's working so hard to eliminate all these things, right? And so COVID, to me, could be a wake-up call that we need to get healthy, because it's not going to only be COVID, it's going to be something else in the future. There's still other infections, influenza and all these other infections. And I think that this should have been, up from last year, a wake-up call that we need to change how we're eating. And this could have been an opportunity for, governments and so on to really focus on primary health care and getting people, their bodies and getting them healthy, looking at the diabetes problem, looking at what we're providing people to eat, sodas and things like that, right? This is the opportunity for us to make those changes so that in the future we can fight whatever comes our way, because there'll be other things.
I have a confession. can you allow me a confession? I may have dismissed the question about long term. I didn't mean to say that. But colleague Hunter, I think, answered that question. We have a situation now. What is public health to do? Public health will do what it knows to do, which is try to interrupt transmission. And if, heaven forbid, get sick, necessary treatments. Plus, if we have a safe and effective vaccine, recommend that. All right, so we have a situation now, and it's 21 months into that situation, and only 11 months since the first vaccine was rolled out. So time. But right now, we have some people. We have a population to protect, to safeguard, and as Dr. Fernandez said, most importantly, we have a health narrative to reconfigure, because the treatment approach, waiting until people get sick, is unsustainable in the Caribbean and proving unsustainable in the richest countries in the world.
Excellent, thank you so much. We have two questions coming from our inbox. The first one is, how safe are COVID-19 vaccines for women with PCOS and fibroids?
I guess that person didn't hear us talk about the fact that we don't know the long-term effects. I think when deciding whether or not you're going to be vaccinated, you have to think about your individual risks of severe infection versus, risk of having a negative outcome from the vaccine. And just to keep it practical for those persons watching, a lot of maybe some people don't go to the doctor, they haven't been diagnosed with diabetes or hypertension or whatever, but two simple things you can sort of do on your own to have an idea of how maybe metabolically fit you are. One is whether or not you are able to walk up a flight or two of stairs without huffing and puffing, right? So COVID, when it gets bad, or if it gets bad, it affects the lungs. If you have no respiratory reserve, no lung reserve, then you're going to have a bad, a situation if you get COVID-19 pneumonia, right? And then the second thing is to take a tape measure or a string and put it on a ruler if you don't have a tape measure, and measure your waist circumference and your hip circumference, right? And if the ratio of your waist to your hip is more than 0.8 for women or more than 0.9 for men, then you know that you probably have some amount of insulin resistance, right? Meaning that all the sweets and carbs, starches, bread, and everything has caught up with you, right? And so you have all this excess fat around the organs in the belly or in the liver and so on. And that is the primary problem driving these non-communicable diseases, diabetes, hypertension, obesity, heart disease, and so on. So if you cannot walk up 1 or 2 flights of stairs without huffing and puffing, or if you are, your waist hip ratio is more than 0.8 for a woman or 0.9 for a man, then you're kind of at high risk, and you might seriously want to consider getting the vaccine, even if you don't know that, you don't know long-term risks, but you know what, I don't have that much time to lose the extra 100 pounds. And, I don't want to be in a situation where I have to be in the hospital, getting this thing treated. So I would say you have to weigh your individual risks of severe disease versus risk of a negative outcome from the vaccine.
May I add to that? I believe it is right, as Dr. Colleague Fernandez is saying, to look at your individual risk and to do that in the counsel of your personal medical coach. Obviously, if a person has a chronic condition, somebody they trust is likely looking after that. I think that somebody is the person to contact to work through all of your questions. I have found it very difficult, and actually I don't venture to answer personal medical questions on the media.
All right, thank you so much. That's fair enough. We have another question from the inbox that says, has any effort been made by any Caribbean states that you know of to source vaccines from Cuba?
I can only say what I recommended to my government.
All right, Dr. Hunter is going to come in here. Dr. Hunter.
Well, he has to speak first.
Yeah.
We love Cuba. You know, they're our brothers in arms. You know, we like to lean towards the leftist movement within inside of all Caribbean people. But the reality is that there's no vaccine that has the magic bullet, even if it's coming from Cuba or China or Russia. In fact, we see Russians heading to Serbia or other former East Bloc countries to get the Western vaccines.
Mm-hmm. That is true.
Vaccines are not enough. They help, but they're not enough. I certainly do not believe that we have the medical evidence to mandate vaccines at this time. But what we do have is enough evidence to make it clear, abundantly clear from political platforms, that early treatment matters. Early treatment at home works. I am a living testimony to that. I've not been vaccinated. I've gotten over COVID about 6 months now. I've treated several COVID patients without PPE and at times without the mask, and I've not gotten back any sick COVID. I've not ended up in hospitalization. I've not died, certainly. So immunity to COVID is actually lasting much longer than the 3 months that we were being led to believe. Natural immunity lasts for more than a year and counting. So the vaccination process needs to take account of people who have gotten over COVID and are really shouldn't be the front of the line to be vaccinated against COVID. It's very, very important. But I want to go back a little bit to the beginning of what I was saying. Caribbean has one of the highest rates in the world of chronic non-communicable diseases. These pandemics or epidemics or endemics within the Caribbean have been left unchecked. They are still our number one, our number two, and our number three killers outside of COVID. COVID has not caught up with these as yet. We have had 18 months to get fit. We have had 18 months to get moving. In fact, ironically, in Jamaica, which the Minister of Health championed what's called Jamaica Moves, and I gather he carried it to the Caribbean in the Caribbean Moves, he shut down the program. He shut it down. And that's the actual solution to COVID. Get metabolically fit. Look like Elaine Thompson, who just created history by doing a double-double at the Olympics in Tokyo, which, by the way, was not a super spreader event. And it's just a pity the Olympics was not held from last year. We've had a lot of hysteria. You have to be very careful in terms of where you go for medical advice. Certainly, speaking in Jamaica, a lot of doctors shut their offices and said that they're not going to see patients again, period. And to this day, there are doctors who have not reopened their practice. So you have doctors who are more scared than patients. That's why you have to be a bit more discriminatory in terms of where you go to seek the advice, who you're seeking it from face to face. There's some doctors who to this day will not see you face to face. And I think it is wrong. It is very sad and wrong. What I strongly recommend to the people of the Caribbean is to look at our diet. Look at what we are eating. Jamaica had a perfect opportunity a few months ago to make a very loud declaration, to adopt the Chilean octagon, to put that dangerous label on the front of these things. Just like how cigarettes have it. These little things here, these little things, these ultra high processed foods are making us fat, they're making us diabetic, they're making us hypertensive. And guess what COVID loves? COVID loves all of them, and more so in combination. We must spend our money wisely. Jamaica spent $12 billion isolating COVID. This is one of the greatest wastes of money in Jamaica's history. Look, no country has been successful isolating COVID, not even Australia, which has over 1,000 deaths. So what we should do is concentrate on getting metabolically fit. Jamaica and the Caribbean was never going to be receiving these mRNAs, no matter what Joe Biden promised. We're never going to be the first in line for these vaccines, and perhaps rightly so, because our death rate is nothing like death rates in New York. So we are not the worst affected by COVID, but so they have kept it to themselves. But it would be nice to get the mRNA vaccines, perhaps more than the AstraZeneca, which you know is a live virus that's injected inside you. But having said that, I strongly believe, based on direct experiential learning, that early intervention, early treatment of COVID works. And I'm not just talking about ivermectin. I'm talking about hydration. I'm talking about oral hygiene, regimented oral hygiene, which is something that we have emphasized in our early home-based conferences. There are 5 early home-based conferences that have been kept in Jamaica and have been attended by people from all over the world. They are on YouTube free. We just ask that you like and subscribe them and share them. Early home-based COVID treatment conferences. They are very informative and instructive. And the FLCCC, the Frontline Critical Care Alliance out of America, we are now happy that they have finally adopted oral hygiene as an important step in the early treatment of COVID. We believe in early treatment of COVID, and we are talking about antibiotics, we are talking about steroids, we are talking about blood thinners. Remember, COVID is not just a virus that's attacking you, it's also the bacteria that's killing you. And bacterial toxins are far worse than viral toxins. So the thrombosis that you get in the 3rd stage, it is very likely that is due to bacterial endotoxins, which are damaging the lining of our blood vessels and causing thrombosis of our lungs and making it almost impossible to breathe, no matter how much you ventilate. Jamaica bought over 100 ventilators, and yet we use about 10, 15, 20% of them. The problem is this: ventilation is a very bad way to treat COVID. Ventilation does not work for COVID. This is what works for COVID. Try and look like an athlete. Try and become metabolically fit, so that when you inevitably get COVID, despite all your measures, wearing masks, social distancing, locking down, sanitize, don't go outside, wearing face masks, you will still get COVID. And when you get COVID, what do? Do you become wait, yard and wait, watch and wait, as the political directorate has said? Or do you start treating early, including use of ivermectin? Well, I submit that the Tuskegee experiment is telling what to do. Treat early. Do not leave it for late. If you go to a doctor who is not enabled with COVID treatment, find another one. I have treated patients all across the world, and I've let my number known: 876-361-2686. 876-361-2686. Because there is a deficit. There is a deficit in the knowledge of what to do about early treatment for COVID. Everybody needs to have one of these. I walk around with it all the time. And this is called a pulse oximeter. I subjected to our chief medical officer, and she said, well, they should only have it if they're in hospital. And that's absolutely wrong. wrong. Even the WHO now has said that a pulse is necessary. So a pulse oximeter should reflect an oxygen saturation of anywhere between 90 to 100%, and ideally between 95 and 100%. And further, we have found by steaming with menthol crystals, we are able to unblock the airway, unplug the airway, and get people saturation, like what happened with me, to move from 79% to 97 and 100% without the use of oxygen. So there has been a significant error in terms of this emphasis on oxygen. And the greatest error is on sitting in your yard, stay home and watch. This is absolutely wrong. We're saying stay home and treat. Today, I dialyzed somebody at home, dialysis at home, a renal failure patient whose creatinine was over 1,500 and the urea was 37. Now it's down to 20s and the creatinine is below 1,000. It can be done. We were called housemen, house surgeons, house physicians for a reason. We need to reimagine healthcare and deliver it early and at home. We recommend vaccines for those who are safe to take it and those who are at particularly high risk from severe COVID. But if you look like the typical football player, and I know that there are World Cup qualifiers going on now, many footballers have had COVID. None have died. So I emphasize to the Caribbean and to your noble audience, let us become metabolically fit. We have had a year and eight months to watch this pandemic. In the meantime, we must now act and act quickly to lose weight, to look at what we eat, to eat vegetables, to eat less meat, to eat less fat, to eat less carbohydrates, and to focus on healthy eating. And that Jamaica needs to adopt the Chilean octagon and stop hiding behind nonsense that, oh, it is going to leave Jamaican business anti-competitive. We need to join with CARICOM and adopt the Chilean octagon on these pretty little packages. You sure they're pretty? They are death traps. Death traps because when you eat these things, your blood pressure rises, your weight rises, your diabetes rises, and of course, your cancer risk also rises. The Caribbean, unchecked endemic of hypertension, obesity, diabetes, high cholesterol needs once and for all to be tackled and to get a grip and look and see what's happening with Haiti. Do Haitians look like us? Do Haitians look disproportionate like us? And the answer I will submit is no. Thank you.
Thank you so much, Dr. Hunter. We have looks like two final questions here. The first is from Nadia. Nadia is asking, both of her parents had COVID. They are age 74 and 64. They're not vaccinated and they're adamant that they don't want it. What other alternatives would you recommend?
I I would absolutely recommend that they look at their structural medical problems. This is not a time to have diabetes and not control it. This is not a time to have high cholesterol and ignore it. This is not a time to have hypertension and ignore it. They must both look at their underlying metabolic illnesses and control them quickly. In addition, I would also encourage them, like what I encourage my parents. My dad is 94 and my mother is 84, and every day they go out into the sun. My dad is a little shaky, so we weren't happy to send him out. When we told him about the sun, he was over the moon and we couldn't stop him. So out he went, taking his sun bath. Healing in the sun is very, very important. So we would recommend to your listener that get their loved ones metabolically controlled. Make sure that they get regular doctor's appointments to control whatever metabolic disease that they have. They should have a healthy diet consisting of a lot more vegetables, not fruits. Fruits are very, very dangerous. Do not fool yourselves. I mean, the sin started with the fruit. The fruit is a very dangerous thing to eat. because it has so much sugar. It has so much things that can cause our metabolic disorders. So we want to look at spinach, lettuce, cabbage, carrot, cucumber. These things need to be held more and more in our diet. And we need to move away from ultra highly refined foods. And so your diet, increase exercise activity out into the sun, have laughter, engage with your family members, and just be close to them. Stay close to them. That should, in case they develop early symptoms of COVID, you can treat early. Oral hygiene. This is the time to go to the dentist. We have enabled a lot of dentists in Jamaica, and people would say, well, going to the dentist, you're afraid of COVID. But the dentists actually worked out quite well. And the dentists have gotten COVID, they've been treated early and gotten over it. But this is about time that you go and get a dental checkup and a good dental education. Thank you.
All right, thank you so much, Dr. Hunter. I would like to invite Dr. Goodwin.
Yes. Well, just to close, I want to remind, well, there's a statement I really love. It's fair is the cheapest room in the house, and we should be in better living conditions. Fear has driven a lot of this pandemic and some of the negative outcomes. We know for a fact that the presence of fear contributes to poor outcomes and death. And CDC actually had a study that indicated that, and I've seen it anecdotally. So we need to get past the fear, whether it's to stop, listening to mass media news and so on, get your community of people, your family or your friends, and, together work towards getting a more, healthy you going forward, right? So that you can minimize disease. Now, for those who are, obviously obese, or if you have that bigger waist circumference compared to your hip, you should seriously consider being vaccinated, not only to prevent death, but to prevent some of the long-term outcomes that we see, like, lethargy and lung scarring of the lungs, etc. Okay, so I'd like to thank DNA for inviting me to be a part of this panel. And I hope I wish good health for everyone. And, the diet is probably the most important aspect of maintaining good health.
All right, thank you so much, Dr. Goodwin Fernandez. We have a question here coming from YouTube. The question asks, Dr. Hunter, why did you mention that the vaccine can have an impact on men's potency and it has not been proven and there is no evidence?
Why is there an indemnification of the vaccine companies if there is no evidence that it does anything? Why indemnify it? Of course, there is a risk. Of course, there must be a risk. Moderna, Pfizer, these companies have a record of breaking the rules. Unfortunately, it's not about racism, it's about greed. Greed drives a lot of decisions in these companies. Slavery was not about racism, it was about greed. Greed is a very dangerous, potent force, and it drives people. Yesterday, we heard Moderna refusing to give up their recipe. In fact, they say they would rather upscale their production. So listen, you cannot say with certainty that an ovary or testes will not be affected by an mRNA technology. It's impossible. Nobody in the world can say in 10, 15, 20 years' time that they cannot be affected because evidence is not there as yet. In the 1950s, if we're arguing about cigarette smoking, we'd have been shut up and said, well, cigarette smoking doesn't cause cancer. Nonsense. It actually is good for you. And guess what? Cigarette smoking causes cancer, heart attack, and stroke. We're not stupid. That if you have the most sensitive organs in your body, the testes and the ovaries, these are the most sensitive structures in fact, when you get around of chemotherapy, they would harvest your sperm and harvest your. It is quite possible, easily, for anything injected into the body to affect your sperms and your ovaries. So to close the chapter on this and said it is quite safe, and it is dismissive and dismiss the fear surrounding these technologies, I think it's quite dangerous. You're not really a student of history. You need to pay close attention to history. Behind Moderna and Pfizer are people. They are people driven by profit. They have made it very clear they want to be indemnified. Why? Why would they want to be indemnified if it was so safe? We recommend the vaccine for people who want to take it and have to do their own research. We do not recommend mandating the vaccine. It would be a tragedy. 70% of Jamaicans absolutely do not agree with mandating the vaccines. And I suspect that is true probably throughout the English speaking Caribbean. So the vaccines is not just about your testes and your ovaries. It's about a lot of other structures, including your brain. We don't know if it will cause an epidemic of Alzheimer's in 50 years from now. Most of us will be dead. So let us not be so dismissive of a possible outcome from the vaccine. Let us be open-minded. The male genitalia is an important target for any insult in the body. We know viruses like mumps affects the testes. And these vaccines, especially the AstraZeneca vaccine, it uses a virus. It's a viral vector. It's a live virus. So I think we have to be a little bit careful how we quickly dismiss risks associated with these vaccines.
The spike protein DNA is put in a inactivated adenovirus. It's the adenovirus, which is the DHL or the FedEx spike protein DNA. Matter of fact, there are no live viruses that are part of the Caribbean's expanded program on immunization. I recommend fruits because Caribbean people know their fruits. And we have the history from Africa and India and China, you know, people who have come here. But things must be done in moderation. Fruits are an excellent source of vitamins, minerals, water, and some energy. But you have to use the energy. So physical exercise, some research is showing, is a bigger contributor, the lack of physical exercise, a bigger contributor to obesity than food. But however, some of that research came from those same manufacturers of ultra-processed products. So we'll continue to watch that back and forth. I don't really spend too much time on Pfizer and Moderna because the world does not revolve around the United States. So I tend to have a more global view of vaccination technology, and I continue to watch the Cuban production with keen interest. They have an excellent track record of making safe and effective vaccines. We just need to see the data. We need to see the data on the current output from Cuba, but I'm optimistic about what Cuba has to offer to the rest of the world. Now, I just Googled the weight of Elaine Thompson-Herah, and I got that she was 123 pounds at the 2019 Pan Am Games. Well, she does not look more than 123 pounds, but you know, let's give her a take. So how does the typical Caribbean person who is 123 times 123 pounds get down to that 123 pounds? In the meantime, they need some specific immunity. They need some specific immunity. Yeah, that's right. It's a terrible thing to waste. But I think we have nothing to fear but fear-mongering itself, with all due respects. With all due respects. We have an excellent track record of public health progress in the Caribbean. Let us rely on that and let the bad news networks from north, we have to block some of that. We have to block some of that and focus on our context. We have a lot of knowledge here in the Caribbean. Let us harvest that knowledge for the benefit of our people. And in public health, yeah, there's early treatment, but there's also upstream protection, prevention. Yes, early treatment and restoration of it, but we have to look at the whole picture. And that's what we do in public health. That's what I learned from being involved in public health. So I think the DNA and others are onto something, Professor Parker. I had a professor by the name of Parker. You have made it possible for Caribbean people to hear Caribbean people talk and argue. Hitherto, the communication environment was dominated by bad news networks from foreign. I call them the BNN. It's a play on CNN, BNN. So although there is some back and forth, we have to continue this kind of dialogue in a non-partisan way, of course. But if a political party has to facilitate it, so be it. But the people in Antigua, Barbuda, and St. Kitts and Nevis and Jamaica have something called the internet, where they could fact check everything that was said here tonight.
Yes. Thank you, Dr. Martin. And I think that is an excellent way for us to close tonight's engagement. I have to apologize to our listeners and viewers because our message boards are still going crazy. The panelists have been very generous with their time this evening, and so we must bring it to a close. Allow me, therefore, to thank Dr. Amina Goodwin Fernandez, who has left us, Mr. Loftus Duran, who has also left us, and we have our two doctors still online, Dr. Roger Hunter of Jamaica and Dr. Patrick Martin out of St. Kitts Nevis. Tonight's discussion is exactly what we expect and what we hope to facilitate in the DNA. A diverse unpacking of the issues without any filters. And as we would have stated at the beginning of this program, we are happy to host this forum as a public service to the country and to the region. Of course, we are happy with the robust discussion that was stimulated, but we must reiterate that the statements should not be interpreted as DNA policy, and that the views and opinions expressed by our panelists this evening are the views of the speakers, and they do not represent the views of the Democratic National Alliance necessarily. Now, having said that, very quickly, there are many things we did not discuss this evening. The whole aspect of community immunity, if that is real, what does normalcy look like, if there is ever going to be a post-COVID-19 period, and, right? And we also did not really unpack that whole question of our public health systems and our public health architecture. And so we are going to take the liberty and just put you men on notice that it is very possible that we will give you a ring to continue that discussion and answer some of the feedback. Having said that, thank you all. Please stay tuned. The Democratic National Alliance will host another COVID-19 Impact Series Forum next week, Thursday, at the same time, 7 p.m., 9 p.m. On occasion, we will discuss the vexing issues of the impact on our constitutional rights, fundamental freedoms. And of course, I do believe that our panel here tonight has set a proper stage for that. So thank you. Thank you, panelists. Thank you, our viewers. and listeners. If I hear someone trying to jump in there. No.
Pleasure to
Okay.
be here. Thank you for having us. Let
Very
us become
good.
metabolically fit.
Be metabolically. Exactly. That is indeed the closing line. Let us become metabolically fit. Eat right, exercise. In fact, Dr. Hunter, you said, look like an athlete. That is the goal.
I've
Thank
lost
you.
30 pounds.
Awesome. Good night, everyone. Good
Good
night.
night. Thanks for having
Please
Good
me.
night. Good
stay
night.
well.
Thanks. Okay. Bye bye.
Thank you.
Bye bye.